another day with some positive news. Yesterday it was Chief James Craig who recovered from the coronavirus and came back and joined us. And today, our City Council President, Brenda Jones, who is fully recovered and back to work. And Madam President, I'll let you start us off, but prayers of the city have been with you, and we're glad to see you back and healthy.
I am so glad to be healthy. And can't say glad to be back because I never went anywhere. I've been working all along. God is so good, and I thank God for giving me the opportunity to be able to say I tested negative and to be here with you all. We've seen so much happen just these few weeks. Every day is a different change, but to know that I have life and I am still here and able to continue on doing the job that I have been doing for the citizens in the city of Detroit is a good feeling. It's a good feeling. And to just say that I retested and have a clean bill of health. And so I just want people to know, because you have tested positive, does not mean it's the end of life for you. You can test positive and still continue to live life. I'm here. I am alive. But I'm still saying to everyone, please take it serious. Please take it serious. Please practice social distancing. Please wash your hands with hot water and soap, and if you don't have any, use hand sanitizer. Also, often we stick our hands in our face. Keep your hands out of your face. It has been shown that the average citizen puts their hand in their face about 20 times an hour. Wear your mask. Wear your mask if you're going to be out. But don't go out unless it's essential that you go out. Please follow the orders that the governor has given us so that you can be safe and you can keep the next person safe. It is so important. I love each and every citizen in the city of Detroit, in Michigan, and throughout the United States, but we have to take this serious because it's taking so many lives. We have to take it serious. Take it serious for the next person that's somewhere near you, and make sure they are 6 feet away from you. Thank you, Mayor, for giving me this opportunity. And I've been watching you all do the press conference, and I can say, if never I've said, I'm proud of what the city of Detroit is doing to fight the COVID-19. Yes, more can be done. And I'm praying that the federal government will give us enough tests so that everyone that feels they need to be tested can be tested. I continue to pray and lift up those that are incarcerated so that they will have all and everything that they need to keep them safe and to keep them alive. And again, I just continue to pray for everyone to take it serious. Please take this serious. Thank you, Mayor.
Welcome back, Madam President. And last week, Sheriff Benny Napoleon was here talking about his brother Hilton, who was on a ventilator and was very much touch and go. And the sheriff today indicated that Hilton is off the ventilator, is in stable condition. And so we've seen positive developments. We also lost 34 of our fellow citizens yesterday. And so we are now up to 572 deaths in basically 5 weeks in this city. But when you look at what's happening, again, everything as far as what the people of the city are doing is positive. The hospitals are all reporting their bed usage, their ventilator usage down 5 and 10% from just 2 days ago. You've seen a number of hospitals now starting to bring back elective surgeries and the non-COVID-19 patients back to the hospital. The TCF Center is now at 21 patients and 979 empty beds. And those 979 empty beds are because the people of this city have taken this so seriously and embraced it the way that you did. Our battle is turning almost entirely at this point to the nursing homes because the people of this city have made it easy for us not to have to deal with the kinds of problems other cities have had with huge crowds. But we've now lost 98 nursing home residents. And Dr. Khaldun is fighting her way through that data. We got a lot more yesterday, and my guess is the 98 is probably understated. I think probably 1 in 5 people who have died in this city are elderly in the nursing homes. We've now done 650 tests, and they're running almost 30% positive. But it varies. We've had some nursing homes as low as 10% positive. We've had others at 50% positive. Dr. Rahman is right now out in a nursing home. The great majority of our 26 nursing homes have been totally cooperative. And we now have a task force that's doing nothing but responding to them. That we found a number of nursing homes were short of personal protection equipment on the staff. The hospitals had figured out, because they were big enough, how to buy it in the world market. Some of the nursing homes weren't. So at this point, we are delivering PPE to every nursing home to make sure what they have. John Zervos and his team are visiting every nursing home, the Henry Ford team, visiting every nursing home every 2 days. And Dr. Rahman, our medical director, is dealing with one of the few recalcitrants we had this afternoon, which after a threat of a court order decided to open their door, and she's over there inspecting them now. But that has been the exception. The great majority of these nursing homes are very pleased at the fact that we can give them immediate test results so they can separate the infectious from the non-infectious. But this continues to be a risk for our city. I want to talk now about the fact that we're about to move into a whole new phase on testing. So I'm really pleased to see that the suburbs have opened up drive-through testing sites, and that's taken pressure off the fairgrounds where basically we were testing everybody in the Tri-County area. We now have capacity to start testing people without symptoms, something we could not do before. And so I want everybody who has a symptom to know you are priority one. Every single Detroiter who's got a cough or a fever or has trouble breathing can get to one of the doctors, and you can get a test tomorrow at the fairgrounds, and you are going to always have first priority. But now we can start to move to where we should be. And if we're going to get this city back on its feet, it means we need to have a lot broader testing. And so starting on Monday, we are going to offer testing for the essential employees in the businesses across the city. I read the stories about employees at Myers and Home Depot that have been affected. We got folks going to work every day at gas stations, grocery stores, banks, a whole series of businesses that we need. They aren't able to shelter in place. They have to be out and interact. And starting Monday, I want every business in the city of Detroit to know that if you have to be open because you're essential, that we will test all of your employees. That if you contact us and say, I'm an essential business that's open today in the city, we will make arrangements for your employees to come through the fairgrounds, get tested, and we are going to have COVID-19 free workplaces in businesses across the city of Detroit. We will prioritize businesses like restaurants and food handling centers, places where it can spread, but we want to support every business in this city, and I just wanted Detroit to be the first city in America that can say to the companies, you have to be open, your employees have to be there. We're going to do everything we can to make sure the employees coming to work are not a risk to their workers. And of course, the employer that will always get priority is the city of Detroit. We have already tested more than 2,000 Detroit employees, and we are going to continue to use the Abbott 50-minute tests for our police officers and others who have had immediate exposure. But if you are a City of Detroit employee who has to come to work because you're essential and you haven't been tested yet, you also will be able to call up on Monday without a prescription, and you'll be able to schedule a test. And so that's our goal, is that everybody that has to come to work in this city will now become a priority at the drive-through testing site. We are going to get through this, and the ability to start testing people without symptoms, to be able to cover entire groups of people is something we've been waiting for, and now we're finally here. So we have a weekend coming up. Right now it's snowing, so it probably isn't terribly attractive to be outside, but we'd ask you again, in the city of Detroit, we are beating this thing. The number of people going into doctors and hospitals in Detroit is dropping by the day, and those 979 beds over the TCF Center, I said 10 days ago the report card of the city would be that, and I never dreamed we'd only have 21 beds occupied after more than a week of being open. But I just want to say thank you to the people of the city. And with that, I'll lead it to the person who's been leading this fight, our health director, Denise Fair.
Thank you, Mayor, and as always, thank you again to your leadership. And I am so glad to welcome back Council President Brenda Jones. I missed you, and you look great, so glad to have you back. I do want to just talk about our cases today, and of course, focus on the nursing home strategy. So as of today at noon, we have 7,406 cases, and as the mayor mentioned, 572 deaths. And always, I do send my condolences to the family. I'd like to now talk about our data. We're always getting questions about our data, which is now available on our website. Once the numbers are shared, they've already changed because we are now in a pandemic and the numbers are changing dramatically. This is always an evolving situation. Particularly with the death rates, determining death rates is always challenging because it's estimated that there are upwards of 10 people with undetected infections for every confirmed case. And in some communities, estimates are even higher. The numbers are just a gauge, it's a snapshot in time, and there's just plenty that we don't know and we're continuing to learn. So for these reasons, we must continue to be diligent towards our slowing the spread of COVID-19 in our community through what we already talk about every day, hand washing, making sure that you're covering your cough when you're sneezing, making sure that you're washing hands, and of course staying home unless you have to go to the grocery store or go to the pharmacy. Earlier this week, the health department rolled out an innovative plan to help stop the spread of this virus in all 26 nursing homes in our city with a 10-day plan for on-site rapid testing. We are continuing to make lots of progress along with the city's first responders, Henry Ford Health System, and our Wayne State medical students. So as the mayor mentioned, we have already administered 650 tests. And this is both for our residents as well as our staff. So we are testing both, and we have been in 8 facilities. We are still on target to hit our 10-day goal. The tests are run overnight, and the more we know, then we are able to provide even more guidance to our nursing homes. And this is really a quick turnaround, and this is a really aggressive plan. The data, again, is used to inform our guidance to these nursing homes for isolation, monitoring, environmental protocols to help diminish the spread through the facilities. As, again, the mayor mentioned, we are seeing an approximate infection rate of about 30%, and at this time we are aware of almost 100 COVID-19 related deaths associated with seniors and staff in our nursing homes. This is why we're also supporting staff by providing PPE equipment, including gloves and masks. And I'm not aware of any other city in the country that is doing the work that we're doing and being really aggressive. So it really is remarkable that we're taking this first step. While these facilities are unique with varying management styles and ownerships, our health department is not taking a one-size-fit-all approach in supporting them through this pandemic. We are literally going, I would say, door to door and making sure the residents have what they need. Now, I imagine we are going to continue to see more confirmed cases, but I know our testing strategy will help flatten the curve, especially towards reducing hospital admissions. I'm really proud to work alongside my team, which includes Dr. Najiba Rahman, who is our medical director, as well as Dr. Carla Bizold, the chief epidemiologist. They have really led the way in providing a great public health response plan for our nursing home. So the mission of the health department is to build healthy communities where everyone has the opportunity to thrive. And long before COVID-19 impacted Detroit, the health department was and continues to be that kind of golden pillar to provide guidance and resources and data and information towards sharing and mitigating this virus in our community. So let's continue to move forward. We still have a long ways to go, but we can beat this. And we know that people are recovering from COVID-19. This is now the second day that we now know that we can definitely beat this. So with that, I'll turn it back over to the mayor.
We'll take any questions.
Is the mic, there we go, okay, sorry about that. Mayor, a couple questions regarding the business reactivation. From WWJ, have you spoken with specific business owners about steps necessary for reactivating on May 1st, and do you think May 1st is a realistic deadline?
So reactivating is going to be based on individual jobs and individual companies. And the answer is yes. I'm spending a lot of time every day, but it's not like we're going to turn the switch May 1st and people are going to come back. At the City of Detroit right now, we are evaluating every single job, and Dr. Dunn, our medical director for police, fire, and DDOT, but also is now taking a broader role, is going to look at plans. And so I think what you're going to see is individual operations will open when they can open safely. And it is very different to have two people in a truck who might be repairing roads than rec center workers with a whole building full of children and lots of different sources of infections. Those two types of operations will open on a very different timeline, and you're going to see businesses in the same way. Some will be able to open safely earlier, and some will take longer.
Okay, related question from Cranes Detroit Business. As these essential businesses have their employees tested, will the city be giving advice, direction in terms of what to do if an employee tests positive?
Oh, sure, although you can read about it in the paper, and the council president could probably tell you better than I can, but here is what we're thinking. That if you are running an essential business in the city, and we're going to screen you, if you call up and you run a barber shop, we're not going to test your employees. It's got to be a business that's open. You call up on Monday, and we will verify that you're an essential business. We will then give you a code and a start date for your employees to all come through the Fairgrounds test site so everybody on your staff can be tested, whether you want to give them the mornings off, whether they do it on Saturday. We will work that out. And then once somebody tests positive, council president can tell you what happens from there.
Well, when someone becomes positive, they go home and isolate themselves. They stay in, and again, they stay in, and they take care of themselves. It is so important that they isolate themselves from other people in their homes so that they won't test positive as well. If they must come out of isolation, I recommend that they wear their mask. I recommend that they drink plenty of water, Gatorade if they have some, and just take care of themselves. And then, when they feel better, after their 14 days, and I would say wait a few days past the 14 days, get retested as I got retested today.
All right. Mayor, regarding the Abbott tests, there had been one report suggesting that some of the Abbott machines may give off false negatives. And a reporter wanted to know if you had any concerns about the Abbott system.
So I am on the phone every day with national labs and national doctors, and I'm totally up on every test and its accuracy. And the Abbott tests, the way we are using them, have been certified as good as any test in the country. And I will talk testing until people are bored to tears. But as we've talked about before, testing for COVID-19 in this country is 90% accurate. That if you have it, there's a 90% chance the test will get it. That's true if you're in the hospital. It's true if you send it off to BioReference, you send it off to Quest, et cetera. If you talk to any doctor or nurse who's been in the hospitals, they will tell you a story of somebody who tested negative, but they look at them and they know COVID-19 when they see it. Because this is so new, 90% accuracy is as good as we're going to get. The University of Pittsburgh Medical Center, one of the leading research hospital systems in the country, tested the Abbott system against the others and found the way we're using it is just as good as any other test. So when you come into the office, as I was, as all our police officers and bus drivers and firefighters were, you come into the office, they swab your nose, they put it in the machine, you get an answer while you're there. Council President just went through that. That's as accurate as anything. What the research is showing is that the way tests are normally done, you take somebody's swab, you stick it in a vial with what they call viral transport medium, you ship it off, you can store it for a week, and they run it through a machine. With Abbott, if you go away from your office and you test it and stick it in a vial and store it for a week, it's shown to get false negatives. We don't do that. There's no point to having the Abbott immediate testing process and then store it for a week in viral transport medium. So it's a long way of saying the way that we are using the Abbott tests are as accurate as any of the other tests on the market. They're just about 4 days faster.
Okay, next question is for Council President. Can't remember which reporter it was. Oh, it was a Michigan radio wanted to know if you had any thoughts or response or reaction to the mayor's budget plan that he rolled out with the other day.
I'm sorry, can you repeat that question?
Reporter from Michigan radio wants to know if you had a chance to look at the presentation the mayor gave on how to address the budget deficit and if you had any thoughts on it.
So I am still reviewing everything that has been presented. I have asked for additional information, and I am sure that I will receive that additional information that I've asked for, and I will continue to review it, and I will soon make a decision. Know that the city has done a lot, and the city has spent a lot of money, so I will continue again to review the budget that the mayor has presented for the COVID-19, and we'll make a decision.
For the health director, chief of public health officer, are there plans, or have we released data by zip code on COVID?
Yeah, so there's been a lot of discussion about being more transparent, and that is our commitment. And so right now, the team of epidemiologists are pulling numbers. So probably in the next, I'd say, 1 hour, you should be able to go. To our health department website, and you'll see every case by zip code for the city of Detroit.
Okay, and another follow-up question regarding the testing for businesses and for other workplaces. Once the employee tests negative and goes to work, what will be done day by day to ensure that they haven't contracted COVID?
Well, because you aren't infected today doesn't mean you don't get infected tomorrow. And so this is going to be the workplace of the future for the next several months. But I was in the grocery store this morning, and the employees had gloves and masks. There's clearly a much greater commitment to safety from the coronavirus than there was. But people will need to go back and follow the proper precautions. All the test does is tell you that you're negative today, and if you decide to go out with a group of people to an event tomorrow, you may be infected tomorrow. So far, we haven't seen a lot of that from our residents.
Okay, Fox 2, Amy Lang would like to know if you have any response to President Trump's tweet about reactivating Michigan.
I didn't see it.
Okay.
I guess I should follow him.
Okay, and finally, we got a few questions from the Free Press.
What did the tweet say?
Oh, it just said reactivate. I think was that the phrase, reactivate Michigan? Oh, liberate Michigan.
Oh,
Yeah.
Okay. It sounds to me like it may be a different agenda.
Okay. So from the Free Press, they want to know, what are we doing specifically to help Detroiters who don't have direct access to doctors? I know you've addressed this before, but if you want to revisit it.
No, I do. 2 weeks ago, it was hard to find a doctor in this town if you didn't already have one. But between Denise Fair and I think we reached out to every clinic and doctor's office in this city, and there are 30 doctor's offices in Detroit taking new patients today. Go to the city website. All 30 are there. Most of them don't require you to have insurance. They'll take you today. They'll probably do it by a phone call or teleconference. But even if you don't have money, they will take you right now. It's phenomenal the way the medical community has stepped up. But in the city of Detroit, if you need to see a doctor today, you can, and we've got 30 doctor's offices taking patients.
A more sensitive question here. The Free Press, again, is looking at whether or not Detroit has been impacted differently by COVID by nature of the skepticism or suspicion that some African Americans have regarding their health and well-being when it comes to the government or medical institutions, referencing, Tuskegee Airmen, et cetera. And they want to know, as mayor, what can you do to reassure people in Detroit that their well-being is being looked after? I spent 9 years running the Detroit Medical Center, and overcoming the racial gap in this country on health care is a challenge, and it's something that everybody who worked there worked on every single day. And really, I think the media in the last month, we may look back on this as the Detroit media's finest hour. I think there's just been outstanding education efforts on this. And I can't go to my Facebook page and not find Council President doing education. So, Madam President, you might want to talk about the way you've been reaching out.
So I just think that it is important that everyone has health care. That is one of the things that I think is so important when you talk about COVID-19 and when you talk about the people who might get COVID-19 and some of the things that are surrounding that individual, and whether or not that individual has health care and are able to take care of themselves as far as their health. And I know that respiratory problems are something that's severe in the city of Detroit, where we have quite a few African Americans. And I myself have asthma, as well as bronchitis, that I probably have gotten within the last 10 years. And so having a mild symptom of shortness of breath I thought was an asthma problem that I have. We know that African Americans experience problems as far as sugar diabetes, as far as cholesterol, as far as high blood pressure, and many of them do not have health insurance to take care of the health issues that they have. And one of the things that I would like to see is everyone with health care. So again, I continue to urge everyone to stay healthy and take care of themselves.
All right, thank you. And last question we have also from the Free Press to the mayor. You faced over time multiple challenges and concerns, and how would you characterize or rank the COVID outbreak? And is it one of the worst that you've seen, and if so, why?
I mean, we've lost 500 people in 5 weeks. I've never experienced anything like this. And, you know, it's the kind of thing you ask yourself every day. Is there something you could have done earlier? Something you could have done better? We're doing everything we can. You know, I'm not any different than a lot of mayors and governors in this country. You can't help but feel enormously responsible, and you ask yourself every day, am I doing everything that I can to change the direction of this? And then you realize that what one person can do is pretty limited. What 700,000 people can do matters a lot more. And what the people of Detroit in the last few weeks have done in social distancing, in knocking down this virus, when we go back and look at the numbers, I think you're going to find that Detroit probably went up as fast as anybody, and it went down as fast as anybody. It is really stunning how we went from 2 patients on a vent in our hospitals and the kind of scenes you saw of overworked workers to now empty beds and the hospital starting to bring elective surgery back. People of the city have responded magnificently.
Okay, and just their final piece of that question, do you see an eventual solution or end to the for the COVID issue?
The end will come when there's a vaccine, and that may be a year from now. Vaccines can't be rushed. You get the dose wrong, and you can do a lot more harm than good. But I think you will see us figure out how to return to work, very likely with masks, very likely with regular temperature checks, very likely with regular checks as to whether folks are infectious, lots more commitment to cleaning and hand washing. I think we'll start to return to work being far more conscious. It'll probably be a long time before we shake hands or hug. But we'll come out of this. But it won't be, I don't know that we'll ever be all the way back. But until there's a vaccine, I don't think you'll see people at movie theaters or at football games in anywhere near the numbers we saw before.
Okay, that's the last question. Thank you.
Thank you all very much.
To thank everyone for all of the well wishes, all of the texts, all of the phone calls, and all of the prayers. It was such a overflow of thankfulness that I felt and gratitude in my heart. And so I just thank everyone who called me, texted me. I could not even get to all of the texts, but everyone who called, everyone who texted, and everyone who prayed for a speedy recovery during the time that I was dealing with COVID-19 and the virus. So I just thank all of the citizens. We have great citizens here in the city of Detroit, and I just want to say my last words are like winter, spring, summer, and fall. The seasons change. This too will change, and we, as strong Detroiters, as strong Michiganders, will come through it. So thank you, Mr. Mayor.
Thank you. Perfect note to end.